Hi, my name is Alexis Exolio. I'm going to be performing my physical assessment today on Mr. Smith. Hi, Mr. Smith. My name is Alexis. I'm going to be your nurse today. If I could have you please verify your full name and date of birth. Okay, thank you. And can you please tell me why you're here today? And do you know where you are? And can you please tell me what day of the week it is? And can you please tell me the name of the current president of the United States? All right, thank you so much. And are you currently having any pain? Okay, I'm glad to hear that you're not having any pain today. And what is your current mood? And do you feel happy typically every day? Okay, thank you. And do you currently take any medications? And any allergies to medications that we should be aware of? And any environmental allergies such as dust, pollen, grass, dogs, or cat fur? And any food or latex allergies. All right, thank you so much for verifying that. Prior to this, Mr. Smith did perform the Snellen chart test and was standing 20 feet away from the chart and did come out with 20/20 vision, uncorrected, and he was able to read more than half the letters on line 8. Vital signs were obtained. Temperature was 98.6 degrees Fahrenheit. Pulse was 68 beats per minute. Respiratory rate was 16 breaths per minute, and blood pressure was 126/78 millimeters of mercury, taken seated on the left arm. Okay, so Mr. Smith, I'm going to go ahead and start my physical assessment. I'm going to sanitize my hands here. I'm going to get my pen light, which I've already sanitized. I'm going to go ahead and check out your ears. Okay, both ears are pink. Ear canals are pink, no redness or swelling or drainage noted, and there's moderate cerumen noted in each ear. Okay, so next I'm going to have you open up your mouth for me. Okay, say ah. I'm going to go ahead and use a tongue depressor here. Okay, tonsils are grade 1. Okay, and if I could have you lift up your tongue for me. Okay, frenulum is midline. I don't know any oral lesions or sores in the mouth. Oral mucosa is pink. Teeth are white and intact. Perfect, thank you so much. I'm going to check your pupils. Okay, so direct constriction, consensual constriction, direct constriction, and consensual constriction. Great. I'm going to have you lean back about 45 degrees for me so I can check for any jugular vein distension. Okay. Okay, no JVD noted on both sides here. So I'm going to go ahead and sanitize my hands again. Mr. Smith, I'm going to just go ahead and touch your head first to check for any lumps or bumps on your scalp, no lesions or scars noted. Okay, everything, skin on the scalp is intact, and overall his appearance is normal. Skin tone is normal for ethnicity. Okay, so next, Mr. Smith, I'm going to check your lymph nodes if that's okay. So I'm just going to feel over here. So preauricular, and then behind the ears, postauricular, and then behind the head, occipital, and then retropharyngeal. Okay, submandibular, submental. Okay, and then supraclavicular. Okay, and then posterior and anterior cervical chain by the SCM here, front and back. Okay, great. I don't feel any abnormal or enlarged lumps or lymph nodes at this time. So I'm going to have you shrug your shoulders for me. Okay, great. And then if I could have you puff out your cheeks for me. And then give me a big smile with your teeth. Okay, and then Next, I'm going to be checking your cerebellar of your upper extremities. So just go like this for me. Okay, perfect. I'm going to go ahead and hand sanitize again before I touch you. I'm going to go ahead and touch your arms now. Let me know if you have any pain or tenderness. Okay, no pain or tenderness, and skin is 1 to touch. I'm going to go ahead and check for edema on the bony prominences. Okay, no edema on either of the upper extremities. I'm going to go ahead and check the cap refill. Okay, less than 3 seconds on both sides. Great. So next I'm going to check your muscle strength really quick. If you could grip my hands as hard as you can. Okay, great grip on bilateral hands. And I'm going to go ahead and have you push down on my hands. Push up on my hands. Perfect. Now I'm going to check your range of motion. If I could have you have your arms down like this. Touch both your shoulders. Great. Now I'm going to have you 180 degrees, touch both your hands together. Okay, great range of motion. Next, I'm going to go ahead and check your carotid and then your heart and your lungs, okay? So I'm going to go ahead and make sure I sanitize both sides of my stethoscope here. So I'm going to be using the bell side to listen for a bruise. If I could have you hold your breath. Okay, no bruise. Hold your breath. No bruise. Okay, I'm going to go ahead and switch back to the diaphragm. And now I'm going to be checking your heart sounds, okay? So I'm checking the aortic valve at the second intercostal of the right sternal border. S2 is louder. Now I'm checking your pulmonic at the second intercostal of the left sternal border, and S2 is louder. Now I'm checking Erb's point, which is at the third intercostal space of the left sternal border, and S1 is equal to S2. Now I'm checking your tricuspid valve at the fourth intercostal space of the left sternal border. S1 is louder. Now I'm checking your mitral valve at the fifth intercostal space at the mid-clavicular line. S1 is louder. And lastly, I'm checking your apical pulse for 1 full minute and 68 beats per minute. All right. So now I'm going to have you take a deep breath each time I move the stethoscope, okay? So I'm going to be checking 6 spots here on the front of your breath sounds. Go ahead, take a deep breath. Deep breath. Okay, I'm going to have you raise your arm here so I can check the breath sounds here. At the mid-axillary between the 4th and 6th intercostal space. Okay. Mid-axillary, mid-axillary between the 4th and 6th intercostal space again. Okay, now I'm going to have you turn around. I'm going to check 8 spots back here for your breath sounds. I'm going to make sure to avoid the scapula. 1, 2, 3, 4, 5, 6, 7, and 8. Okay, so now that I have you turn around, I'm going to go ahead and check your respiratory expansion. So I'm going to make sure I go beneath the rib cage here. Okay. And there's symmetrical respiratory expansion. Great. Okay, so now I'm going to have you I'm going to go ahead and check your lower extremities. So let me know if you have any pain or tenderness. Warm to touch. Okay, so now I'm checking the pulses, the popliteal pulses behind the knees. 2+, checking the pulses of here, dorsalis pedis, 2+ on both sides as well. Now I'm going to have you push, check your muscle strength, push down on my hands, please. Okay, push up on my hands. Okay, I'm going to make sure you have a full range of motion. If I could have you bring your knee all the way up to your chest. Okay, knee up to your chest, great. And then checking your hip expansion. Okay. Okay, so great range of motion on your hips and your knees and your legs. Okay, so after that, I'm gonna have you sit back again. I'm gonna just check your reflexes quickly. I'm gonna sanitize my equipment here. Okay, so I'm gonna go ahead and check your biceps. I'm gonna have my thumb here on the antecubital. Okay, so there's definitely forearm flexion and forearm flexion on both sides. Now I'm using the other side to check the triceps, sorry about that, behind the elbow here. Forearm extension. Now I'm checking your brachioradialis reflex, and I'm going to be 2 to 3 inches above the wrist. And as you can see, patient is in semi-pronate position first, and there is supination and supination. Now I'm going to check the reflexes. Mr. Smith, have you had any prior knee injuries or knee surgeries? Okay, so I'm going to check the patellar reflex on both knees. He said he has not had any prior knee injuries or surgeries. Okay, so great flex on both knees there. Okay, so I'm going to just sanitize again. I can't remember if I checked your eyes yet, so I'm going to go ahead and do that. I'm going to sanitize this again, sanitize my hands. So if I could have you, I'm going to use this direct and consensual constriction on both sides, and then follow my finger accommodation, and I'm going to check the 6 fields of gaze to check for nystagmus. If you could just follow my pen light. Okay, sorry, I wasn't sure if I checked that already, but just wanted to make sure there's no nystagmus. Okay, so lastly, I'm going to have you, I don't know if I had you smile yet, so I'm going to have you do a big smile for me, puff out your cheeks. Okay, so that's just checking the facial cranial nerves. I'm going to have you lay down, and I'm going to just check here at eye level. And I don't see any pulsations. Abdomen is flat. Okay, so now I'm going to go ahead and make sure this is sanitized again. I'm just going to take a listen to your bowel sounds in all 4 quadrants, starting here in the right lower quadrant, right upper quadrant, left upper quadrant, right lower quadrant. Okay, so 16 to 20 gurgles heard in each quadrant. Now I'm going to go ahead and switch to the bell and listen at the left midline of the abdomen. Okay, no bruise, great. So now I'm going to go ahead and percuss to check for tympany in all 4 quadrants. Okay, tympany in all 4 quadrants. Now I'm going to go ahead and lightly palpate and let me know if you have any pain or tenderness. Okay, no pain or tenderness noted. Okay, so I'm going to have you sit back up for our last couple of tests here. I'm going to go ahead and do the smell test. If I could have you cover one nostril and close your eyes. Okay, great. You could smell the coffee. cover your other nostril, keep your eyes closed. All right, you can smell the tea. Okay, so next I'm going to do the whisper test. So I'm going to stand 1 to 2 feet behind Mr. Smith. And if you could cover your right ear, Mr. Smith. Okay, now cover your left ear. Okay, great. So perform the whisper test. He's able to hear my whispers. And next I'm going to do the Romberg test. So I'm going to have you stand with both of your feet together and arms at your side. Close your eyes for 20 to 30 seconds. I'm going to be standing behind you like this to make sure you don't fall or sway. Okay, great. No swaying or falling. And I'm just going to check your gait, your walk. So if I could have you walk 5 steps from here, 5 feet. Okay, now turn around. I'm going to have you walk heel to toe. Okay, great. I'm going to go ahead and check your upper extremity cerebellar. If you could go like this for me. Okay, great. And then your lower cerebellar, I'm going to have you put your foot and slide it up your leg on both sides. Okay, for the lower cerebellar. Okay, great. Let me think here. Okay, I believe we have finished our physical assessment today. So that's it. Thank you.